Hey friend, welcome to the Self-Care Isn't Selfish podcast. I'm your host, Emily Nichols. As a Whole30 certified coach, wife, busy working boy mom, and your self-care guru, I'm here to help you start putting yourself first without the guilt. Each week you'll hear motivating and practical tips on how you can create a habit of self-care through interviews with my amazing guests or quick solo episodes with me. After each episode, you'll walk away with an action plan and feel empowered to implement what you have learned into your life. So grab a cup of coffee, glass of wine, or your favorite sparkling water, and let's do this. You're listening to episode 17 of the Self-Care Isn't Selfish podcast. Welcome back. I'm so glad you're here. I hope you had a wonderful Thanksgiving with your family and your loved ones, and you enjoyed your food freedom. If you're not sure what I'm talking about when I say that, go back and listen to episode 16, where I share some strategies to help you maintain your food freedom throughout the holiday season, because that can definitely apply throughout this whole next month. And just a reminder, the January Whole30 is quickly approaching. If you want to join in on my exclusive January Whole30 group, I only offer it in January and September. Just follow the link in the show notes. You can learn a little bit more about what my course and community looks like. What's really exciting is my course is now on an app, and there's a free online community via the app. It's like Facebook, but it's not on Facebook, which I really, really like. But throughout the January Whole30, my group gets exclusive videos from me, daily emails, free downloads, including a shopping list, self-care checklist, non-scale victory checklist, and so much more. And because I love my podcast listeners, if you enter the code at checkout, self-love, that's just SELFLOVE, all one word, all caps, you will receive a special discount for being a Self-Care Isn't Selfish podcast listeners. So if you want to stop dieting, you want to find the healthiest version of yourself and find your own version of self-care, let's get going with the January Whole30 together today. On today's episode, we are talking with Dr. Vickie Bhatia. She is a licensed clinical psychologist and fellow Whole30 certified coach based in Chicago. I really enjoyed this conversation with Vickie. We talked about relationships and self-care. And you really have to advocate for yourself and be assertive in regards to what your self-care needs to be for you in all kinds of relationships, not just with your spouse or partner, but with your colleagues, with your boss, your kids, any other family members or loved ones. Make sure you stick around to the end, because we share some really great strategies to help you navigate your relationships and what your self-care needs to look like. Let me tell you a little bit about Dr. Vickie Bhatia. So, like I said, she's a licensed clinical psychologist, and in her therapy practice, she works with individuals and couples on things like overcoming fear, increasing self-worth and connection, and handling emotions in a healthy manner. Vickie shares some really great tips for us today, and this is such a wonderful conversation, an important conversation, and I hope it opens up some avenues for you to feel comfortable to talking about other people you have relationships with as far as what your self-care needs to look like. So sit back, relax, and enjoy this conversation with Dr. Vickie Bhatia. Okay, I am here with Dr. Vickie Bhatia. I'm so glad she's here on the podcast. We're going to be talking all about relationships and self-care today. So, Dr. Vickie, thanks so much for being on the show today.
Thank you for having me.
Awesome. Well, obviously, this is the Self-Care Isn't Selfish podcast, so we talk all things self-care. So I want to know from you, what does self-care mean to you?
Sure. So I think of self-care as anything that promotes mental, emotional, or physical health. And it sounds like a really easy concept, but I know that it's really difficult to actually incorporate into our lives, because it requires us to sort of be attuned to our own needs and to know ourselves and to figure out what's going to contribute to our physical and psychological health. And I often also talk to clients about, I think that it's equally important to think about like what self-care is not. And so like self-care is not like a prescriptive set of behaviors. It's not like do these 5 things, and that will kind of fulfill the checklist of self-care.
Absolutely. Yeah, like how you said, you got to focus on what self-care is not. And I don't think people realize it can change day to day and season by season, hour by hour in some
Absolutely. And I think, there's a lot of behaviors that in different contexts could be self-care or not.
Mm-hmm.
And so I often talk to my clients about, what self-care is for one person may not be self-care for another person. And it actually really frustrates me when I see like social media posts and things like that about, like binge watching a show is self-care, or treating yourself to a mani-pedi is self-care. And that definitely can be the case, but I also see people in my practice who are watching TV or even like excessively sleeping as a way of avoiding things and numbing out, or people who are spending a lot of money on what they think is self-care, but then they're just kind of stressing themselves out with their finances, and so it actually just contributes to their anxiety.
Yeah, exactly. I talked to a client a couple weeks ago, and she was saying, if she was to watch TV and like binge watch a Netflix show all evening, she said that would be more destructive to her than
Absolutely.
self-care to her, which was really interesting. So, well, tell us all a little bit about you before we dive into relationships and self-care.
Sure. So I'm a licensed clinical psychologist. I'm also a Whole30 certified coach, and I live in Chicago. And I have a private practice where I work with individuals and couples. And I know we're talking a little bit about relationships today, so I'll talk a little bit about my approach to working with couples. So I am certified in a couples therapy called Integrated Behavioral Couple Therapy, or IBCT, which research has shown to be effective in increasing relationship satisfaction. And the way it does that is by helping partners sort of be able to talk more openly about vulnerable or difficult thoughts and emotions, which then helps partners understand each other a little bit better. And then kind of once that foundation's in place, being able to really look at specific behavior changes that can improve the relationship.
That's awesome. You're kind of like a mediator in getting the couples to talk to each other. I think sometimes we just don't talk to each other. It sounds so simple, but it can be so challenging.
Yeah, or we think we're talking, but we're not really.
Yeah. Well, I'm really excited to dig in and get some advice and professional advice from you. And hopefully this will be, a really great experience for my listeners as well. But I want to dig into a little bit about relationships and self-care, because I personally feel like since I've been on my own self-care journey, it's helped strengthen my relationship with, in particular, my husband. Because I'm figured out how to put myself first. I feel more confident, and over time I feel more confident letting him know that I need more time to myself, and he's very supportive of that. But I'm wondering why I feel like, but at first it was very challenging for me to be able to say, hey, I need some time to myself to go do this or just do this. And why do you feel like it's so challenging for people to make their own self-care a priority in a relationship?
I think that a lot of times, especially women, we tend to prioritize family and friends, work, chores, other commitments kind of above ourselves. And because we're sort of at the bottom of the list, it's really easy to skip over when we run out of time or energy. And I think that some of the things that make it difficult to kind of advocate for our own self-care needs are, things like just being able to actually be attuned to what those needs are in the first place, being able to figure it out for ourselves. We can't sort of advocate for that if we don't really know what we're looking for. But also, I think that there can be potentially a lot of emotions involved in self-care and asking for help or space for self-care. So I think that, guilt is definitely a common emotion that I talk about with my clients, but also potentially other negative emotions like anxiety or shame. There's a level of vulnerability in advocating for ourselves. And so for some people, asking for help, even from a partner, and maybe actually particularly from a partner, is really hard. And I think that if we have beliefs about we're supposed, beliefs about like our need to be independent or to be able to handle things on our own, or that asking for what we need is, a sign of being selfish or weak or needy, or any of those kinds of stories that we might tell ourselves or have been taught. That just makes it that much more difficult to kind of engage in that.
Yeah, absolutely. Now, you mentioned, kind of being self-aware and figuring out what self-care means to you. So you're able to communicate that to a partner. How would you suggest someone figure out what self-care means to them? Because like what we just mentioned, someone taking a break and watching, 2 or 3 episodes of Friends feels really great. And for other people, it could be destructive. How would you advise someone to figure that out?
That's a great question. I think there's a couple of things. So I think the first thing is that it's a trial and error kind of process. I don't know anyone who has just gotten the self-care thing kind of right on the first go. And so I think that part of it is, trial and error, kind of figuring out what feels good, what is kind of nourishing and replenishing. And also recognizing that those things are going to change over time. And so that's the other tricky part about this, right? So like you were saying, what is self-care on one day may not be self-care on another day. And so, I kind of wish that it was easy to just say, like, figure these 3 things out and then you'd have it kind of figured out. But unfortunately, it doesn't work like that. I often, when I'm talking to clients who really don't even know kind of where to start, one of the things that we look at is talking about like what are some of the things that they might be doing that they really do not want to be doing. So maybe that's taking a few things off of their plate or their calendar. So like if they don't have time to be on a committee or volunteer for an organization, then being able to kind of think about what the consequences might be, and actually really figuring out if those consequences are real. And then if there's minimal or no consequences, being able to sort of be assertive and say no to those things. I think that sometimes it's figuring out like what are the things in your life that are bringing up negative feelings for you, and then kind of looking at what are the things that we can kind of control in that situation. And then I think kind of more broadly, it's about figuring out what are the things that are important and meaningful to you. And these can be really small things that are done on a daily basis, or these can be kind of larger things that might be more occasional, but figuring out kind of what are the things that make you feel good, even if they're not necessarily easy. I think that that's also kind of sometimes a misconception that self-care is supposed to be easy or always feel good. And sometimes self-care is actually doing really difficult things that we know are going to kind of set us up for kind of psychological or physical health kind of down the road.
Yeah. Oh my gosh, that's great. Well, and I like how you mentioned, sometimes self-care might be figuring out how to say no or taking things off your plate. And I know Whole30's kind of taught me how to do that because, back in 2015 when I first started my Whole30, I'm sure you can speak to this too, even with your clients as well, no thank you is a full sentence and it's really hard and you feel like you have to go into a long spiel about why you're doing Whole30 and why, you're not doing this or doing that right now. When really, you don't owe anyone an explanation about why something isn't serving you or why you're doing something like a elimination protocol. And the more you do it, the more over time you see it's not so scary and it's a really easy habit to develop. I've just eliminated a few things on my plate recently with a couple of jobs because I had like 20,000 jobs and I needed to narrow it down a little bit. And it was really scary to do that, but it was so freeing. And I feel like, Whole30 kind of helped me figure out like, hey, saying no or no thank you is okay. And being able to move on for that. Would you say the same?
Yes. And excuse me, I did my first Whole30 in 2015 as well. And it was such a learning process, not just sort of from the nutritional aspect, obviously, but just all the other factors that come along with that in being able to, like you were saying, like advocate for yourself and be assertive and figure out where your boundaries are and how to kind of communicate those to other people. And so, yeah, I think that all of that comes along with that.
Yeah.
I'll tell you a little bit of a trick that I sometimes use
Okay.
when when I'm not sure if I want to say yes, or I'm pretty sure the answer is no, but I want to buy myself some time. So one thing that I've kind of figured out is that if you say no to something, and then after the fact, if you decide like, actually, I would like to do that, or I would like to, participate or whatever, most of the time people are totally fine to have you come back and then get engaged. And so like sometimes like I will say no to things, and then after the fact I'm like, you know what, I actually do have time and that would be kind of cool. And so I, can go back to the person and say, you know what, I actually had some time, open up in my schedule, or I had something kind of drop off and I have, room for that now. Are you still looking for help with this? And most people are thrilled to have you kind of come back and get involved, versus agreeing to something and then trying to back out of it. I think that that's where a lot of people, then there can be a lot of negative feelings and some tension. And, so I try to kind of do it the reverse way.
That's a great idea. That's a great idea. So instead of saying yes and then trying to back out and then feelings get hurt in both parties, sometimes just say no and you can always go back later.
Yeah, and of course, it like doesn't always work. There are deadlines for things and whatnot, but I find that for at least a lot of like social events and things like that, this works really well.
I love that. I'm going to use that now. I'm going to use that now. So going back to communication, I know we talked about trying to figure out our own form of self-care, but what's a form of healthy communication to talk to your partner or a loved one about how you or when you want to make yourself a priority, or hey, just saying, hey, I just need 30 minutes to go read, or just, it's really nice that I want to go for a walk by myself. How would you, with a couple or even friends for that matter, get them to talk about how they can put self-care as a priority for them?
I think the first thing is strategically picking the time to have that conversation in the first place. So really trying to find a time when both of you are not physically or emotionally drained, and when there are minimal distractions. And I know that this can be tricky, and real life scheduling can make this, difficult. But even if that time has to be scheduled, I think that this can be really useful, because trying to have this kind of conversation when when one of you is like hungry or cranky or ready to go to bed, those things just kind of can make this conversation that much more difficult. The other thing is that really when you're having that conversation, to try to minimize distractions. So not looking at your phone, turning the TV off, not just turning the TV on mute, but really turning it off. Not trying to multitask or do a bunch of other things. So sometimes I work with couples where, one partner is trying to like clean up after the kids and the other person is doing the dishes, and they're like trying to have a conversation, but they're just missing each other, right? Mm-hmm. And so, really trying to give each other kind of your undivided attention.
How's that saying go? Oh yeah, all things are possible with coffee and mascara. Well, that's certainly true for me, and I love to have my coffee every morning after my workout, and I don't really leave the house without mascara. So my fellow blondies, I know you feel me on this. But gang, check it out. Having my coffee every morning is part of my self-care routine, and I always take my coffee blended with Nutpods and coconut oil. So Nutpods is a dairy-free creamer. It's made from a blend of almond butter and coconut cream. I love the French vanilla flavor. It's my favorite. It's super yummy, super smooth, but even better, it's Whole30 approved. So gang, head on over to nutpods.com and use the code EmilyNichols22 to get 15% off your first order of Nutpods. That's EmilyNichols22, EmilyNichols22. And let me know once you receive your Nutpods what your favorite flavor is and how you take your coffee. So remember, just head on over to nutpods.com.
Yeah. And then I think the other kind of big piece of this is that if the conversation starts to become really heated, to kind of agree to take a time out. Trying to communicate when one or both of you are really highly emotional is likely to be unproductive. And one of the things that I see doing couples therapy is that sometimes one partner is really reluctant to have a timeout. And that's usually because the timeout really isn't a timeout. It's more of an avoidance strategy. So the timeout is only useful if there's a time in. Otherwise, it's just like an unresolved conversation, right?
Yeah.
And so I ask my couples to set like a clear time limit for the timeout. I try to recommend, no more than 30 minutes, but obviously I know that sometimes that's not possible if one of you is walking out the door to go to work, or, the kids are being dropped off, from an extracurricular or something like that. But just having a really clear time of when you guys are going to come back and talk about it. And even if that's just to request a little bit more time. So if you come back 30 minutes later and you say, like, I'm still really heated, I'm still really upset, I need another 30 minutes. Just having that conscious sort of coming back together point is really important, because otherwise the timeout won't work. And then this is when people are really reluctant to give any kind of space when there's kind of that conflict.
Yeah. So it's interesting. So with just communication with your partner, having strategy and intention behind it is super smart. Just with you saying that, I know a lot of times we'll be going to bed and all of a sudden I'm like, blah, 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 blah to my husband. And I'm like, he's not listening to me. I mean, he's wanting to go to sleep, but it's not the ideal time to be having a conversation about something. And I know he gets really frustrated. Bless his heart. He does the dishes every night because I usually cook dinner. Or vice versa. And then, we're trying to get homework done and the kids are talking, and it drives him crazy when we can't have a conversation one-on-one together because the kids are just interrupting. Cause I know his love language is time together. And I've kind of learned over time, like, hey, I need to make sure, like, if he's wanting to talk, I need to put my phone away. I got to make sure the kids are away and let them know, hey, Dad and I are having a really good conversation and we'd like to, have uninterrupted time, which I know is hard. But yeah, having some strategy and knowing how your partner best communicates and when, that's so smart.
Totally. And I have couples that will kind of like have a scheduled out time, like Saturday morning, when the kids are still sleeping or they're watching, cartoons or whatever. We're going to make coffee and we're going to sit down together and, have an hour, just the two of us. Nothing's going to get scheduled during that time. And if we have nothing big to talk about, then great. We just have an hour together. Right. But if we do need to kind of have time together, even if we can't make that work during the week, we know that we have this time on Saturday or whenever it is.
Yeah. Schedule it, like put it on your Google Calendar, write it on your paper calendar, and it'll more than likely happen if you do it that way too, for sure.
Yeah. And I think that that's actually just like a larger piece to self-care, right? Self-care is not going to spontaneously happen. And so it has to be like planned and effortful.
Yes. Oh my gosh. So now, Vickie, what if your partner is not very supportive of you? If you're like, hey, I need 30 minutes to myself, and they're like, ugh, well, I need 30 minutes to myself. Well, I mean, what would you do in a situation like that, or advise a client?
Yeah, this is tough. And I wish that there was an easy answer to this. But I have a couple of thoughts.
Okay.
So I think the first is that it's really important to make sure that you're communicating not only what you need, but why. And sometimes I see this all the time with my couples. We think or we expect our partner to know what we need or what we're thinking, or to remember that because we said it one time, 4 months ago, that they should remember that and apply that to the current situation. But that's not the case. And so I often see partners who believe that they have been communicating what's going on for them, but it's not really getting at the core. It's really kind of just staying at the surface rather than really getting to, why it's important. And so I think the first piece is, not only saying what you need, but how your partner can help, why it's important to you, and then how it gives back to your partner in the relationship. So I think, people, I think that other time, if we're not really clear as to why it's important and how it actually helps us as a couple, it is really easy to get into this kind of like back and forth and keeping score of, you got half an hour, so now I should get half an hour. And, I did this for you, so now you need to do this for me. And that is a really bad place to be. So for example, I had a couple where they had 2 young kids, I believe. And one partner was basically kind of like demanding a night out with their friends, which not surprisingly didn't go over well with the other partner. But it was when the first partner was actually able to really kind of say why it was important and how it would actually help the family. It was received so much better by their partner. And so I think the first piece is like really open and direct communication, and talking about those like underlying thoughts and feelings, not just about like, I'm really frustrated, I'm really tired, I need time, right?
Yeah. Like you said, just digging into why you need it and how it can strengthen the relationship for everybody is vital.
Yeah. And I think, sometimes I think that there's, I don't exactly know where this comes from. I don't know if this is like a societal message that we've been getting, but sometimes we expect our partner to be everything for us. And that is not a realistic that's not a realistic role for most couples. That's not to say that there aren't a few out there who, that is, working for them. But I think that more often than not, we need other people, and we need a community and other support, and advocating for our needs in those ways actually can be really helpful because it relieves some of the pressure from our partner to kind of be everything for us.
Yeah, I totally get that. Yeah. I feel like in this past couple of years, I've really, I was so defined by like my family's everything. And I'm like, well, I should come first too. And I definitely am a better mom and a better spouse because of it, because I am spending time with friends. I am, interviewing great people like you and making connections like this. It really does help, help me come into my own self and help me be the better version of myself, for sure.
Mm-hmm. And I guess the second piece to your question, which I wasn't trying to ignore, is, truly what happens when your partner is not supportive. And I think that this is really hard to navigate. And this is where couples therapy, or speaking to some other trusted third party, whether that's a religious leader or community kind of member or trusted family member, can be really helpful. But I also think that, if you've tried all these things and your partner isn't even open to having that conversation, then one of the questions, and this is really difficult, but I think one of the questions has to be kind of whether this relationship or the partner is kind of capable of meeting your needs. And obviously that's not a decision to be made lightly. But I also think that, unfortunately, some relationships are not going to be an environment which that can sustain kind of growth and personal change.
Absolutely. We're all constantly in a state of growth, that's for sure. And either someone's growing with you or you're leaving them behind, unfortunately. So how would you say, you're starting to make yourself more a priority, you're making, your own self-care a priority. How can you maintain that connection with your partner at the same time?
So this is really interesting. And I think it goes back a little bit to this idea of like expecting our partner to be everything, right?
Yeah.
And so Esther Perel is actually a couples therapist, and she talks about cultivating desire. And the idea here is that, obviously with too much distance between partners, there can't be a connection, right? If you guys are living completely separate lives, it doesn't leave much room to come together. But there's also, the situation in which there's too little distance between partners, and connection also can't happen there. So the idea is that if we need a level of kind of separation in order to be able to connect, to be kind of two distinct individuals who choose to come together. And if the partners are fused and they're acting kind of like one entity, there's no coming together. And so the idea is that if we actually have some separation by having individual endeavors or things going on, then we're actually excited to come back together. And, generally speaking, people are attractive to us when they feel good about themselves, when they're confident, when they're passionate about something in their lives, when they're kind of in their element. And so going off to do that is exciting and interesting. And whether that's, a side business or getting involved in an organization or whatever that is, by doing that individual endeavor, it allows you to come back to your partner with something to talk about, stories to tell, things to connect over. And there's kind of like this excitement to be able to kind of come back and share that.
Yeah. Well, at times, your partner may be your person where you want to share things that are going on in your life, whether it be work, personal, business, whatever.
Totally.
So yeah, I can totally see how that can help strengthen that connection with your partner as well. Do you feel like this can be applied towards other relationships, not just with a partner?
Yes, for sure. So I think that you mentioned love languages, and I know that we think of love languages as kind of specific to kind of intimate relationships, but I think that love languages can actually be applied to any kind of relationship, whether that is a romantic partner or a friendship or even kind of a work colleague and things like that. So let me actually take a step back and explain what love languages are. So it's a framework from Dr. Gary Chapman, who talks about there are different ways in which we all kind of express and feel loved and valued and appreciated in specific ways. And the idea is that we tend to use our primary love language to communicate love and appreciation to other people. But if we are not speaking their primary love language, it might not be received or have much of an impact. So he's identified kind of 5 love languages that I'll go through really quickly if you are good with that. Okay, so the first is words of affirmation. And so this is, kind of verbally, like using words to build up the other person. So in a relationship, this can be things like thanking the other person for, doing something, telling them the positive impact of their behavior, giving them compliments. So
that's totally my love language.
So in a self-care context, right, it's like, thanks so much for watching the kids when I went out, to dinner with the girls. I really appreciate you, like, helping me find time to connect with my friends. Like, I'm really lucky to have you as a partner, right? So like that, for people whose primary love language is words of affirmation, like that is going to make them feel valued and appreciated. The second one is acts of service. And this is my primary love language. So this is like taking something off the to-do list of your partner, especially if it's something that they don't like to do, and without being asked to do it. Right? So doing a chore around the house or taking care of something. So like for me, like if you take my car to get an oil change, like that means more to me in the world than like any other gift. Like acts of service is definitely my love language.
Awesome.
The third is quality time. So putting kind of distractions away, right? So giving your partner your undivided attention, blocking off time for them, turning off your phone or putting it away, really making eye contact, being, kind of present in the conversation. The fourth is gifts. So this is like any small token that shows that you were thinking about the other person in some way. This doesn't have to be like a big fancy gift all the time. This could be, something as little as like getting them, something from the grocery store, right? So like, hey, I know that you love cherries. They're in season. I saw them, thought of you, picked up a bag, right? And then finally, physical touch. So that's sort of being physically close to your partner, kind of physical affection, sexual intimacy, that kind of thing. And so, I think that using love languages can also be if you can identify what your primary love language is, And that can also be a potential cue as to what self-care might look like for you, right?
Absolutely. Well, and communicating that with your partner as well. And I know with Dr. Chapman, there's even a quiz you can take on love language for your kids. And
Yeah,
I could totally see what both my boys, what their individual love language is, and really, communicating with them that way. And it makes our relationship stronger as well.
completely. Yeah. And it's so interesting because when I meet with couples for the first time, we go through the assessment phase. One of the questions that I ask is, how do you kind of show like appreciation or like praise for your partner? And then how do you know that your partner is pleased with you? And it's always really interesting when there's kind of a really clear mismatch, right? So somebody's like, I always thank them, but like their primary love language is, quality time or something. And so it's like those words are in one ear out the other, and they're not being kind of received.
Absolutely. And gang, I'll include a link in the show notes. I know there's a quiz you can take to kind of find out your love language. That was really eye-opening for us, even to figure out our own love language and being able to communicate with each other in that way too. So Dr. Vickie, this has been so eye-opening, and I'm going to take a lot of these tips and advice that you've given us today and apply them towards my relationships and thinking about my own self-care. And I think all in all, it really helps strengthen your relationship. And I think you've given us some good key strategies to be able to communicate with our partners in a better way and make ourselves a priority and as a win-win for everybody. That's for sure.
Well, awesome. I hope that this can be helpful for people because it is definitely something that's really important.
Absolutely. So can you tell everyone where they can find you and connect with you?
Yeah, the best way to find me is over on Instagram. My handle is just at Dr. Vickie Bhatia. My website is the same as well. So if you are in Illinois and you're looking to work with a therapist one-on-one or in couples therapy, all my services are on my website over there.
Wonderful. Dr. Vickie Bhatia, thank you so much. You're going to be able to help so many people through this, and I so appreciate you taking the time today.
Thank you for having me.
Awesome. Thanks. Well, I am sure I can speak for all of us that we just learned a lot from Dr. Bhatia. Vickie, thank you so much for this conversation. I personally learned a lot, and these are things I want to implement into my everyday life. So let's share my 3 biggest takeaways so you can start implementing this into conversations, into your relationships today. Number 1 takeaway I had from this conversation was all about healthy communication. Scheduling time for when you need to have these important conversations. Don't be having them when the kids are screaming or, if your spouse or partner just gets home from work. Or if you're wanting to have a serious conversation with your boss, maybe don't do it Friday at 5 p.m. Just saying. But, in regards to talking about what self-care needs you need when you're talking to this person you have a relationship with, let them know what you need and the why behind you need it. If you just say, oh, I just need 30 minutes to myself, I just need time by myself, that's not really going to be as effective as saying, I really need 30 minutes to myself. It allows me to relax, to reset, so I am able to be a better spouse, a better worker, a better mom, for example. And don't keep score. So if your spouse is, he got to go out with some buddies, or my husband likes to hunt. It's hunting season right now. If he's going hunting, I'm not keeping score because it all evens out and we all have our own versions of self-care that we need. And keeping score is just not going to lead to a good outcome for anybody. The second biggest takeaway I had was you cannot be defined by your partner. I learned this the hard way years ago when I was just defined by being a mom and I wasn't putting myself first. And there's no shame and no guilt in that. And maybe you're defining yourself by your partner, but like Dr. Vickie Bhatia mentioned, separation is good. Has your spouse or a partner ever been on vacation or you haven't seen them for a couple of days for a work trip, it always feels good when you come back together and you share how you've been able to recharge and, how you're feeling. Or if not, then maybe that's a whole different other discussion. Maybe you need to contact Vickie and talk to her more about that. But you can't define yourself by your partner or your kids. The separation is good, and that can be a form of self-care as well. And lastly, learn your love language. Like I said, mine is words of affirmation. My husband's is time, just time together. And I'll include a link in the show notes for a quiz that you can take. You can also take a quiz for your kids to find out their love language. But, it's really good to find this out and have an open conversation with your spouse. I have with my husband. I've been like, hey, babe, my love language is words of affirmation, and I need that. I really do. Like when I filled out the quiz, I was like, it's going to be words of affirmation. And I knew it. And his is just time together. So I'm really intentional and not trying to be on my phone, after the kids go to bed. It's just our time together because I know that's his love language. And I think it will really help with communication, especially when you're advocating for what your own version of self-care looks like. So again, just focusing on healthy communication, scheduling time to have those important conversations about what your needs are. Number 2, don't define yourself by your relationships. That separation is good. And lastly, figure out what that love language is. So I hope this conversation, like I said at the beginning, opens up some more conversations with the relationships you have in your life. And, you go through different seasons of self-care. You go through different needs of what your self-care looks like in your various relationships. And I think it all just boils down to open communication and allowing yourself the space to give yourself self-care and not feel guilty about it. So take a screenshot of you listening and tag me in your stories at Emily Nichols22 or at Self-Care Isn't Selfish Podcast. And I would so appreciate it if you leave a rating or a review on iTunes to let people know how much you're enjoying the show. I'll include a link in the show notes as well so you can follow along with Vickie on Instagram and check out her website. She has so many amazing things to say, deep conversations that every time I read one of her captions, I'm like, dang, she just nailed it on the head. So thank you again, Vickie, for being a guest. I hope this conversation helps you with your relationships and self-care. And until next week, gang, remember, self-care isn't selfish.